Hello, I'm Dr. Mark Masotto, head of the prostate imaging section in the Department of Radiology at St. Joseph Hospital. Until recently, prostate cancer staging consisted of physical exam, serum PSA, bone scan, and sometimes a CAT scan depending on the patient's Gleason score. The problem with the old prostate cancer staging scheme is that none of the tests could accurately determine whether the cancer had spread from the prostate gland into the adjacent pelvic structures. MRI now fills that imaging void. With the advent of prostate MRI, the urologist and radiologist are able to accurately determine if there's any microscopic spread of disease from the prostate to the adjacent pelvic structures. This allows the radiologist and the urologist to accurately determine the extent of disease and to tailor the treatment plan to the individual patient's needs. A certain subset of patients will be found to have very small volume, non-aggressive tumors. Those patients may be chosen to enter into an active surveillance program where the urologist closely monitors the patient's disease with serial MRI and PSA. In general, prostate MRI is very safe. There is no ionizing radiation. The patient simply lies on a table for about 20 to 30 minutes, and the test is done. Most insurance companies and Medicare will pay for prostate MRI. The usual exclusionary criteria for MRI apply. Those include no implantable heart devices, no cardiac pacemakers, certain aneurysm clips, and metal heart valves. In particular for MRI of the prostate, we like to have the patient have no hardware in the pelvis. The metal hardware in the pelvis will degrade the quality of the images of the prostate. So that would include no hip arthroplasties, no hip screws from a prior hip surgery, and no pelvic hardware from any pelvic trauma. If you have any questions, I would invite you to call St. Joseph Hospital, Department of Radiology. Thank you for your time.